If you ever left the doctor's appointment feeling like something was missed, you're probably right. Not because your doctor doesn't care, but because the way healthcare is structured, providers sometimes only see a portion of the full picture. And the part they don't see is usually the part that explains everything. I want to talk about something that doesn't get explained clearly enough. There's a specific kind of person that ends up in this situation. They're not neglecting their health. They're actually doing a lot. Therapy, doctor's appointments, and sometimes maybe even medication. They're showing up for their care, and yet something still kind of feels off. They leave appointments with answers that don't fully address what they're experiencing. They get treated for one thing, but then there's other things that still don't have answers. Or they get told it's stress or anxiety, or it's just part of life. And they start to wonder, am I missing something? Am I describing something wrong? Is it in my head? Which it's not in your head. There's a structural reason this keeps happening. And once you understand it, it changes how you approach every appointment going forward. Here's what most people don't know about how the healthcare system is actually set up. Your mental health provider and your medical provider are operating in two separate systems. There's different notes, different priorities, and different definitions of how symptoms get categorized. And in most cases, they're not communicating with each other, which means there's a gap in between them. And a lot of people are falling in the gaps without even realizing it. And I'm going to explain exactly what that looks like, and more importantly, what to do about it. So stay with me. When you see a therapist, they're trained to look for patterns in your thinking, your emotion, your history, and your stress responses. When you see a primary care doctor or specialist, they're trained to look for patterns within your physical symptoms, your lab reports, or your medical history. And both of these perspectives are valuable, but here's the problem. The mind and body don't operate in separate systems. They share the same nervous system, the same hormones, the same stress response, which means what shows up emotionally can have physical roots. And what shows up physically can be worsened or driven by what's happening mentally. Fatigue, brain fog, headaches, digestive issues, sleep disruption, mood changes. Any of those symptoms can be medical. Any of them can be stress related, and many times they're both. But if your therapist is only documenting what's happening emotionally and your doctor is only evaluating what's happening physically, then the overlap between, which is the full picture of what you're experiencing, lives in a blind spot. And let me just say, neither of these providers aren't necessarily doing anything wrong. They're each doing their job within their specific scopes. The problem is nobody's job is to see the whole pattern except yours. You are the only person who sits across from both of these providers, which means you are the only person that can bridge what's actually missing. And most people aren't taught how to do this. Now, let me give you a specific example of how this plays out. Someone goes to the doctor for fatigue, low mood, and disruption with their sleep. The doctor asks a few questions, note that they're under stress, and refers them to a therapist. Seems reasonable, but what if the fatigue had a physical component? A thyroid issue, or maybe a vitamin deficiency, or maybe an inflammatory response? What's the cause of the low mood? If that question never gets asked because the doctor filed it under stress, it never gets evaluated. And this person spends months in therapy for something that has a medical root that nobody even tried to look for. This also works in the opposite or the other direction. Someone is in therapy and the therapist notices that they're struggling a little bit more reactive, more shut down, harder to engage. What the therapist might not know is that this person has been dealing with chronic pain for the last 3 months, or that their medication has recently changed, or that they've been getting 4 hours of sleep due to a physical issue that hasn't yet been addressed. Those physical details change the entire clinical picture. But if they never get communicated, then the therapist is working with an incomplete picture, and the treatment reflects that incompleteness. Again, this is not about blaming providers. It's about understanding a structural limitation and how to work with it instead of against it. The information gap exists. The question is, What do you do with that information? Earlier, I said there was a structural reason on why your symptoms keep getting missed. Here's that reason in plain English. Providers make decisions based on what gets communicated, not just what you're experiencing. Most people aren't taught how to communicate the full picture, not because they're not smart enough, because appointments move too fast, because it's hard to think clearly when you're under pressure, because nobody handed them a system to navigate this. What gets documented shapes what gets diagnosed. What gets diagnosed shapes what gets treated. And what gets treated determines whether you actually improve or whether you keep cycling through care that treats on the surface but never addresses the underlying roots. So what does it look like when someone starts to address that gap? It starts with documentation. Not because you're the medical expert, but because a clear, organized record of your symptoms, when they've started, how they've changed, what makes them better or worse, and how it impedes on your daily life, gives every provider you see a fuller picture of what's happening with you than what a rushed verbal summary could ever do. It also means understanding how to frame what you share. Providers respond to specific pattern-based descriptions. I've been exhausted is easy to file away under stress. I've been exhausted for 8 weeks. It doesn't improve with rest, and it's affecting my ability to concentrate at work with just even the basic tasks, is a pattern that requires a different level of attention. Same symptom, completely different clinical weight, just based on how you presented it to the provider. And it means knowing how to share that information across multiple providers, bringing relevant notes from your therapy sessions to your medical appointments, sharing physical symptoms with your therapist so that they have context. This isn't oversharing or trying to diagnose yourself. Just making sure that the people responsible for your care have enough information to gather the full picture. That's advocacy, and it's something anyone can learn. I want to give you some specific patterns to watch for. If your emotional symptoms like low mood, anxiety, or irritability always seem to get worse alongside physical symptoms like pain, fatigue, or hormonal shifts, that is absolutely something worth tracking and bringing up to both providers. If you've ever been told that your symptoms are stress related and you actually address the stress and those symptoms persist, that persistence is a data point that needs to be communicated. If your symptoms change with your cycle or when your medication adjusts, with sleep, with diet, those patterns matter medically, so document them. If you've left multiple appointments feeling like multiple things weren't yet addressed, that feeling is important. That feeling is information. You're picking up on a gap that isn't yet named. And if you're ever sitting across from a provider, unable to articulate what you're actually experiencing, that's not a you problem. That's what happens when anyone is trying to condense months worth of complex symptoms into a 15-minute window. Your symptoms matter. Your experience is valid data. The problem was never that you didn't have enough information. The problem is that the system wasn't designed to collect all this information from you clearly. That's what we're changing. I built something specifically for this situation. It's a 49-page workbook called the Mental Health X Medical Care Self-Advocacy Kit. It walks you through how to track your symptoms in a way that providers can actually use, how to prepare for appointments so that the top 3 things that you want to address don't get forgotten, how to clearly communicate with your medical provider and your mental health provider, how to recognize what symptoms need a different evaluation, and how to advocate for yourself confidently and calmly, even when you're not feeling your best. It's $27, less than a copay. I will link it for you guys to be able to check it out. If you've been navigating both mental health and medical processes and feel that it's been incomplete, this is for you. In the next episode, we'll go deeper into what happens to the brain and body when it's under prolonged stress and why the usual advice to rest doesn't work in the way people intend it to or expect it to. If this video has helped you see something differently, share it with someone who's been struggling to get clear answers from their providers, especially if they've been told it's just anxiety. They need to hear this too.